everybody. My name is Dr. Stephen Tourjee, and I'm a Harvard-trained psychiatrist with specialty training in child and adolescent psychiatry. And we're here today to talk about coronavirus. Specifically, how do we manage our stress and anxiety related to coronavirus and the pandemic globally? And what can we do as kids and teenagers to work throughout a system in which we don't know what's going to happen and we don't know when things are going to get better? And I'm here to tell you that not only can we stay informed and learn more about the virus ourselves, but we can also employ certain strategies to try to work through this. To start out with, what is even a virus? What is a virus? Well, it's a microscopic organism or parasite that basically hijacks our cells. It hijacks and takes over the cellular machinery in order to make copies of itself. And it does this in a way in which our immune system can get weakened and it can replicate and replicate and replicate. And what we need to do is realize that a lot of us are vulnerable to this infection. None of us is immune, whether we're kids, infants, or elderly individuals. And we all need to do our part to stay safe. This virus is so small that you can't even see it with a light microscope. You need an electron microscope in order to view it. And the particle size is probably about 120 nanometers, and 1 nanometer is 1/1000th of a meter. So what are different techniques that we can use and think about when we're thinking about this pandemic? For one, I've come up with a mnemonic, and the mnemonic is COVID, COVID. The C stands for check the facts. We need to make sure that we're using reputable resources in order to find out what's going on with the coronavirus. So there's a lot of websites out there that are just not very reliable, and those are a lot of social media websites like Facebook, Instagram, Twitter, those sorts of things. And what we need to be focusing on is the websites that are really good, such as the CDC, which is Center for Disease Control and Prevention, in addition to the WHO or the World Health Organization. Those websites are going to be sources of really good information. And make sure that you rely on those to find the most up-to-date information about the pandemic. And we also need to really limit our media exposure, because if we're constantly being bombarded by the news and the latest updates as to how many cases there are and what's going to happen next, and are we going to be having more deaths here or there, it's just not helpful. So limiting media exposure is going to be important. After the C, we have O. O stands for open your eyes. Open your eyes to what's going on around you. Make sure that you're maintaining social distancing. And I actually prefer the term physical distancing, because social implies that we're not connecting with each other relationally and that we're just kind of holed up in our houses in home confinement, not doing anything. But physical distancing implies that even though we're apart and distant from each other, we are still there for each other emotionally in other ways. And we have to be creative about how we continue to maintain those connections. A lot of my patients are struggling with this right now in terms of figuring out how are we going to work through the boredom, the loneliness, and the isolation, being at home, being in tight quarters with parents, with other siblings, with other family members, and then having to try to do school virtually through Zoom and other things. Some of my patients who are in college have been sent home. In fact, most all of them have. And it's very hard to kind of maintain a good routine educationally when you're now confined to the home setting. So make sure you're practicing safe physical distancing and that you're building a routine and maintaining that healthy routine. The V stands for validate. Validate your emotions. And these emotions would be whatever it is that you're feeling, whether it's anger, frustration, anxiety, a sense of panic, a sense of doom, a sense of isolation or loneliness. It's important to validate those emotions so that you can have an outlet for that, and so that you can be able to express yourself effectively to those around you in terms of what you're going through. Never worry alone. And when you're able to express yourself and validate your own emotions and those of your family members, you're able to have a deeper bond with them. The I stands for improvise. We need to improvise ways to continue being productive. Many of our family members' parents are having to be more creative about ways to make more of an income because their income is limited by what the coronavirus has done to our economy. But we, as kids and teenagers, also need to improvise ways in which we can continue to be productive and stay socially connected. That includes getting our homework done, getting up on time. Maybe we're figuring out how to connect with people online through video game outlets, through servers like Discord, and through all of these other different outlets. And we need to remember that and to continue to share that with each other so that we can all stay connected during this difficult time. The D finally stands for decompress. We need to decompress and have an emotional outlet for our struggles. Whether that's continuing to exercise and finding creative ways to exercise, whether it's talking to a therapist or a psychiatrist, or whether it's maintaining a sense of faith that this is really a temporary sort of suffering for a pandemic which is unknown and it's uncertain when all of this is going to go away. So having a way in which you can decompress and express your emotions effectively and stay positive throughout this is going to be very key. And that's it for now. Thanks for watching. Really appreciate you tuning into my channel. If you do like what you're seeing, give it a thumbs up, share it with others, and look forward to seeing you next time.